So good evening. I want to start off by thanking everyone for joining us. So my name is Jose Alberto Arevalo, and I am proud to be the board chair for Latinx Physicians of California. On behalf of LPOC, I want to welcome you all to this important discussion on California's healthcare future. We thank you for taking the time to listen in on this discussion as we all work towards strengthening our healthcare system. I want to thank those that are participating in today's event as well. I'm excited about the wonderful panel of presenters we have for you today. I especially wanted to thank two organizations that support LPOC and our efforts in this area. To Adventist Health and Radio Bilingüe, thank you for getting behind this effort and for your partnership. As an organization, Latinx Physicians of California is committed to working to improve the quality of healthcare and improve access for our Latinx community, our underserved populations, and for all Californians. We know to be able to best serve our patients, we must understand their needs and the issues that impact them. We believe that we can best do this if we have a strong, diverse workforce to serve our ever-growing California population. Today, we seek to continue moving this dialogue forward, to seek effective actions that will improve this issue in California and create the physician and healthcare workforce that we all need for the future. For our attendees today, you will have the opportunity to submit questions to our panel for discussion later in our event. Please find the Q&A button on your screen and feel free to submit your questions as you have them. We will try to get as many done as we can. And I want to take now the moment to introduce our panel of speakers. To save time and get to the topics, we have all decided to just share names, titles, and organizations. Each of these presenters has a wonderful background, and you can find that information on our LPOC website. So I encourage you to go there and learn more about each of our speakers. In the order that our speakers will be joining us today are, first, Dr. Sandra Hernández, who's president of the California Healthcare Foundation. Then next will be Dr. Michael Drake, who's president of the University of California System. Following him will be Dr. James Cruz, medical director for Blue Shield of California and one of our LPOC board members. Griselda Aguilar, who is the MiMentor student CEO, will follow. And after that, Karina Diaz, which is the Latino Medical Student Association Western Area CEO, will then be followed by Dr. Joaquin Arambula, Assemblymember, California's 31st Assembly District. And then finally, Dr. Carrie, Byington, Executive Vice President for UC Health, will complete the presentations, and then we'll start our panel discussion. So to start things off, I'll turn over to Dr. Sandra Hernández.
Thank you, Dr. Arevalo. I appreciate that. Good afternoon, everybody. Thank you to the Latinx Physicians of California for organizing this conversation today. As you can see, we have a really fabulous panel of speakers. And so I just wanted to start by offering a little bit of a frame, and then we'll jump into our speakers and do Q&A. You know, we are, of course, in the midst of responding to perhaps the largest public health threat of our time in the form of COVID-19 and the pandemic. But of course, we're also facing structural racism and its manifestations, both as it relates to COVID-19, but really have been longstanding and are quite persistent. We have seen structural racism as being a driver of health inequities, with poor health outcomes in all kinds of areas: hypertension, diabetes, cancer, overall mortality, life expectancy, and health status in general. And we know that the conditions with which people are born, where they grow up, where they live, where they work, where they age, are all responsible in some form for what are really avoidable differences in health status. And I think that's really the focus of our conversation today, because we have significant evidence and know what these discrepancies are and really how to address them. Just today, the Public Policy Institute of California issued an interesting report just looking at educational attainment by geography by census tract in California. And while the Latinx community represents nearly 40% of the population of California, only 13% of our population has a bachelor's degree, and students who are enrolling in CSUs often can't get into the majors that they want. And we know there are significant barriers all along the way in the pipeline to our healthcare workforce and to our medical workforce. And we also know that pipeline programs work. And one of the things we'll hear today are some of the examples of those programs. And I think as you hear our speakers talk about them and what we've learned from them, the real question is, how do we scale them? How do we sustain them? And how do we systematically reduce the barriers that we know we need to do in order to let the opportunities and the talent be able to emerge? And we're going to hear from students and young people who themselves have been working through these programs and finding their way. As we come out of the pandemic, I think it is super important for us to double down on the resources that we need to support these pipeline programs and to make sure that the resources that our young people need to seek opportunities in healthcare are made available to them. We've already seen reductions in applications for financial aid and the lack of real-time advising and programs that can help people navigate their way through these programs. So with that, I'll stop and give it over to President Drake, and he'll talk about what the University of California is doing, has been doing, and has committed to do. Dr. Drake.
Well, thank you very much, Dr. Hernández. That was a quite helpful distillation of some of the challenges and opportunities ahead of us as California's leaders and future leaders in healthcare and health education. And I know I'll have to leave a little bit before the end of the session that you're beginning and Dr. Byington is finishing. And I just am thinking about our long association with each other on the foundations and boards that we've worked on and serve on now, and how the issues that you do in the California Healthcare Foundation, things you've been focusing on for such your founding, are these issues of equity and quality and how they affect the state of California. Carrie and I both serve on the board of the Commonwealth Fund, and that's a foundation that's now come in its second pandemic since it started about 1918, but looking at those same issues. And you know very well that Mark Smith, your predecessor, serves with us on that board. And so this is work that we've all been involved with. We've all worked together for years and involved in this work for much of our lives, and are committed to continuing to push it forward. So very nice to see you and the rest of our colleagues. I particularly going to say hello to the chair, Dr. Arevalo. It's very nice to see you, and Assemblyman Arambula, nice to see you as well. And pleased that there used to be a time when medical doctors weren't things like university presidents or elected officials. So maybe there's a new age here in the 21st century, but great to see you in your role, and look forward to continuing to work with you and the rest of the panelists. And I'll say that to the Latinx Physicians of California, the Alliance and Mentorship and Latino Medical Student Association, great to see and to work with all of you as well. It's a great opportunity to gather virtually, at least on a matter that's of critical importance to our state and indeed to our nation. So I'm happy to be here and to have a chance to talk with all of you. We'll say one more word about Dr. Byington because I'll be off, as I mentioned, by the time she's there. I happen to be on the nominations committee for the foundation in which we both serve, and we look for years for members. And the foundation was well represented on the East Coast and a bit on the West Coast, but I at the time was in Ohio, and Dr. Byington was in Texas, and so we said, great, we could have really strong representation from other parts of the country in this foundation, and now we work in the same building. So we started representing the center of the country, but we ended up together back here at the University of California. But always great to see you. And I know you will be talking about pipeline programs and things that have been going on for a while. One of the things that I had the chance to do is really to start with some programs and then leave for a while and come back and see them as they've changed. I will say that in particular, I'll focus back a little over 20 years ago. I had the privilege of being the co-chair of a thing called the California-Mexico Health Initiative. And I was co-chair representing the University of California, and Roberto Conyo, who was the Undersecretary of Health for Mexico, reporting to Julio Frank, who was the Secretary of Health, were my counterparts in Mexico. And we had a series of programs that we started and growing from those programs. Socio Castaneda, I'll mention as well, growing from those programs was an initiative that we called UC Prime. For the Prime is PRIME for Programs in Medical Education. And it was a program to, in the aftermath of Proposition 209, to develop a pathway for diversification for the healthcare education pipeline here in California, to be able to develop practitioners who would be able to be sensitive to the needs of populations who were underserved broadly and had been underrepresented in medicine. And so we began with a program, and there are obviously multiple categories of people who are underrepresented in medicine. The Prime programs address many of them, but the very first Prime program was one that was called Prime LC, which is the Programs of Medical Education for the Latino Community. And it started at UC Irvine. Actually, the year before I went to Irvine, I was in the predecessor to Carrie's position when the program started. And then a year later went to Irvine and was able to see the program grow. And I mention it because just to try to be hopeful as an old man, I have a photograph of myself with the first class that was in my office in Southern California and went with me to the Midwest and is in my office now. And there were 9 people who were in that class graduating. And then I have a nice photograph from a year and a half ago on a 15th anniversary, and there were about 200 people in that photograph. And so we were able really to see that there was some growth and some roots were laid down, and those roots led to people, and those people are now leaders. And it's good to know that these things can move forward. It's never enough. It's never finished work, but it was great to be able to come back and see that the efforts are continuing, and that where there were 5, there are now 10, and where there were 10, there are 50, and where there were 50, there are 100, and that things can move forward. I'll also say that I just got information on, I can't quote the numbers, I think, because this is not, we'll release it when we have it all finalized, but this is the 2nd year in a row for the University of California that Latino students, Latino Chicano students are the greatest fraction of our entering class of acceptances for our freshman class. And we had a record number of applicants last year, and then this year we had a 12% increase in Latino applicants, so Latino Chicano applicants. So we know at least that the pipeline is continuing, and we're pleased to see that change. What we have to continue to do, that's now, I mentioned the Program of Medical Education on one end, and I mentioned entering freshmen on the other side. So those are 2 ends of our educational pathway. One of the things that we really need to do at the university and continue to work on is making sure that we can diversify the house staff, diversify the faculty, diversify the leaders in medicine in the state. So we begin with the pipelines, we build those trainees who can be the leaders of tomorrow. We have to continue that work through those leaders becoming manifest. We have many who are on the call today, and so that's great. But as we all know, as we heard, the number of people who are serving at the highest levels is not nearly enough to be fully representative. And so we're going to continue to do that work. And I'll say also that when we bring our students to our campuses, getting students there is one thing, but really helping students to graduate and really to thrive and be a part of the institution is something that we are continually working on in the health sciences as well as across the university. And we are very focused on those things. We really need to support students in all the ways that they need to be able to be as successful as they can be. So to the students who are here today and are members of this organization and looking at your careers and your future, I'm eager to hear from you and respect very much and admire your engagement and your commitment to making the world a better place. And we will do everything that we can on our end to try to make that pathway as smooth as we can. And finally, I will just say to all on the panel, I'd love to hear from the rest of you, so I'll stop my comments, but there's a lot of work to do. I have remained focused on this work for decades. I'm pleased that I can see that there's been progress. It's been not as fast and not as much as I would like, but I can see things getting better. And I know as we redouble our efforts and look toward the future, we can continue that progress moving forward. Thank you very much for hosting this event, and I look forward to hearing and learning more from all of you this afternoon. Thank you.
Well, thank you for sharing your vision for the UC system, Dr. Drake. We look forward to working closely with you and your team. So next up is our own LPOC board member, Dr. James Cruz. James?
Yes, thank you, Jose. And Dr. Drake, thank you very much for sharing your insights and vision. And I wish I could start with a cheery note, but clearly, COVID-19's tragic impact on our Latinx community and other communities of color has amplified the importance of taking bold action to strengthen the supply and distribution and diversity of healthcare workers in primary care, behavioral health, and geriatrics. So it really shouldn't be surprising that now more than ever, LPOC is tightly aligned with the recommendations of Governor Newsom's Future Health Workforce Commission. And moreover, with the new administration in Washington and Secretary of Health and Human Services, who is deeply aware of California's healthcare workforce needs, the timing is right to take that bold action. But I also want to make sure that we don't overlook the fact that there are gaps in the scholarly work and the research that's inclusive and meaningful to the Latinx community. And as such, we seek to work closely with you and the UC system to promote an academic and research agenda which fully embraces the development of our emerging Latinx leaders to be the lecturers, the researchers, and the clinical professors who educate and train this future workforce. So it would be remiss if we didn't applaud the good work that's been done by the UC system. I am proud to say that I'm a product of the UC system myself, both as an undergraduate at Davis and at UC San Diego. I don't want to say when I when I graduated, but let's just say that I've benefited greatly from the great work of the UC system. But it's clear that challenging work lies ahead. And we are committed to supporting and partnering with you, Dr. Drake, and the University of California to do that important work. So with that said, I happily yield to two of our emerging leaders who are eager to share their experiences with you. And thank you very much.
Thank you, James. That was great for sharing our LPOC perspective. Please, we want to welcome our next speaker, MiMentor CEO and soon to be medical student at UC Davis, Griselda Aguilar. Griselda.
Thank you, Dr. Arevalo. Buenas tardes. Good evening, everyone. My name is Griselda Aguilar. I'm honored to be part of this critical conversation, the need for a more diverse healthcare workforce. I myself, as a first-generation student, my path towards a career in medicine has not been easy, to say the least, but I am confident that it has been my background coming from a farm-working family that has provided me with the life experiences that have developed my resilience and my passion for giving back to underserved communities in any way that I can. I like to say that I'm a product of pipeline programs because growing up in the Salinas Valley, attending Soledad High School, I was a part of the migrant program. And then in college at Fresno State, I was fortunate to have the Health Careers Opportunity Program directed by Dr. Kathy Flores. And thanks to HCOP, I was able to receive the mentoring necessary to face the emotional, the academic, and many times the financial barriers as the first in my family to pursue a career in medicine. With HCOP, I had access to clinical experiences that I would not have been able to access. And I was able to shadow for the first time a Latino physician in the Central Valley. This was Dr. Jose Luis Bautista. And in his clinic, he was primarily seeing farm-working Spanish-speaking patients. There was Vicente Hernández playing in the background in his clinic. And those patients really reminded me of my own grandparents, my Diaz, my tios, and my community. But with HCOP, I also had exposure outside of the Central Valley. I was able to participate in a summer internship at UCLA called Pre-Medical Enrichment Program. And there I further learned about those health disparities in communities like Watts in South LA, and the challenges that these communities of color face when trying to access culturally incompetent care. And at that same summer in 2014, I still remember I met Dr. Efrain Talamantes, who introduced me to MiMentor. And I was eager to bring MiMentor to the Central Valley with the effort to create a community of leaders, again, who want to return to the Central Valley as physicians. And today we continue to grow our mentors and mentees in California and across the country through MiMentor. And we are actively linking students with healthcare opportunities. That's really the most rewarding part about my role in my leadership with MiMentor. But overall, it has been MiMentor, HCOP, and PrEP at UCLA, some of the pipeline programs that have taught me and where I have learned to advocate for myself and advocate for my community. I'm really grateful for the various mentors that have supported me. This definitely took a village, and I'm very excited, like Dr. Arevalo said, to share with you all that I will be attending UC Davis School of Medicine this fall. Si se pudo, we did it. And I look forward to contributing in medical school to the diversity and bringing other medical students to join me in the mentoring movement with MiMentor and our app and website. And finally, as my MiMentor familia says, together we mentor, together we lead, because we can't do this alone. Thank you all. Gracias.
Griselda, thank you very much for those great words. Clearly your future leadership is going to shine. So we appreciate you joining us today and saying those words. So now I want to please have you welcome another impressive student leader and one of our other board members, which is Karina Diaz, who Ph.D. and current medical student. And Karina, please, the floor is yours.
Thank you so much, Dr. Arevalo. Hello, everyone. I am here in the on-call room, as many of you can tell with my scrubs on. So unfortunately, I wasn't able to leave the hospital on time, but I'm super excited to be here and share a little bit about my story and my past with you. As you heard, I do have a PhD. I chose a little bit of a different route. I'm an MD PhD student. And I did that for various reasons. One, I love medicine and I love research. Two, I have so many more opportunities to help teach and help others hopefully reach whatever their path and goals are for the future, because I get to touch that many more lives as I go through my journey. But even in research and in medicine, it's not easy. And since we had Griselda talk about her path to get into medical school, I talk about what I've been through since I have been in medical school. And there are a lot of things that I think can be difficult for a Latinx person. One is, I feel like as a Latina, we're so used to having a village that we work with. We're always surrounded by other people growing up. And so when I get to med school, and then all of a sudden it's this very much individualistic way of learning, that made it very hard for me just starting off, trying to find people that were kind of willing to study with me. And so I learned to study by myself on my own, because even though they say there are advisors, the advisors are like, you're doing great, keep going. Not always the best advice, but I made it. I made it through. And I made it to grad school. In grad school, even my directors would say things that would make me question why I was admitted. Things like I would talk about my project and talk about some actually very interesting, amazing things. And they'd ask me, oh, you did that with your own two little hands? So it's like, I feel like part of the issue of being a minority in medicine is that we're still seen sort of as these token minorities. So often they make us feel as if we're admitted because they needed a brown person, not so much because we deserved it, we earned it. And that's been very frustrating, but with every step that I succeed in, I feel that much better about what I'm doing. And slowly finding different people who support me no matter what has helped me along the way. But obviously, I'm hoping that there will be a way to make this path a little bit easier, especially with the MD PhD route. There are very few medical students that are Latino. There's even less who decide to pursue a career like the MD PhD. But I did it. I got my PhD. I graduated. So I am good enough and I'm doing great. I finally made it to fourth year where I can actually go to clinics and work with people who love working with minorities. And so they teach me like they would teach anyone else. I'm not used as an interpreter. If anything, they're excited that I can speak with patients directly, but they will still call for an interpreter to make sure that I am not that person in that role, which can often be an issue once we're in clinic. Instead of learning the medicine that we're supposed to, we're learning medical Spanish so that we can translate for everyone else. I love doing it, but that's not the reason I'm there. However, it's been great. So I still love medicine. I still love research. And I've been using my positions as part of LPOC, as the CEO of LMSA-West, and now the president-elect for LMSA National, to continue to influence more Latinos to pursue careers in research and medicine, because we need them. Researchers from different backgrounds will provide new ideas, new ways of looking at the same data that I'm hoping will help improve the health of Latinos overall. And so that's why I'm doing what I'm doing, and I'm hoping that every step that I'm taking will help encourage someone else.
Great. Thank you so much, Karina. And, appreciate all those great words and having these dynamic young professionals tells us that our healthcare future is in really good hands. So now we are honored to have with us today supporter of LPOC, a good friend, and the only Latino physician in the state legislature, Dr. Joaquin Arambula. Dr. Arambula.
Thank you, Dr. Arevalo. I won't happen to notice that you called us dynamic young leaders before you introduced me. It makes me realize I might have now gone over that hill, and that's totally fine. Did want to start by just also acknowledging Adventist and Radio Bilingüe, if I could. I used to work at Adventist, and Hugo Morales, who's the executive director and co-founder, actually hired my dad for Línea Abierta, a show on Radio Bilingüe more than 2.5 decades ago. And so I'm glad to see that they're supporting groups like Latinx Physicians of California, as it's important, and you're doing great work. So I'm so pleased to be joined here on a panel with Dr. Hernández, Dr. Cruz, Dr. Drake, as well as soon to be Dr. Aguilar, as well as Dr. Diaz, to be able to talk about the issues that are facing our state. Now, I haven't always been an assembly member. I just got elected 4 years ago. Prior to that, I spent 10 years where I was an emergency room doctor in Selma. It's the raisin capital of the world. If you're not familiar with it, it's in the breadbasket of the world in Fresno County. Now, we are the #1 ag producing county in the state, and thus the nation, and probably the entire world. And because of it, we have large farm working communities that I am proud to represent and had the honor of serving when I was a physician. But I came to a realization when I was working in the emergency department, que yo no puedo ver a mi gente solo, that I cannot see my people alone. And so it really required me to ask something more of myself. I, like so many of the students who are here, sacrificed and went to school and became my dream, but realized that we needed to do more to make significant changes within our community as well. And so I asked more of myself. I had to ask my wife if we could leave my career and if we could run for office and try to bring back more professionals to the Central Valley and frankly throughout the entire state. And so it was so encouraging for me to hear Griselda talk about HCOP and the benefits of that pipeline program, as I as well have seen the benefits of it firsthand at Fresno State. This year, I've introduced a piece of legislation, AB 1306, which would create a state HCOP program. We've seen the benefits of the federal HCOP program. How do we make sure we can extend that program, those mentorships, those opportunities to both UCs, CSUs, and community colleges? How do we start the pipelines at different points of entry for students? And so many of our Black and Brown students aren't always starting at four-year universities. So hopefully with this piece of legislation, we are able to scale and grow programs and start to see the benefits since we only have a few of them currently in the federal HCOP program. I also wanted to highlight, if I could, one of the best programs you have at UCLA, if I can be biased, and that's your International Medical Graduate Residency Training Program. Over the last decade, we've seen more than 140 physicians who have been trained through that program, who have both cultural and linguistic competencies that are coming back to areas like mine. I am carrying a budget ask this year to help to grow and hopefully to scale that IMG program so we can continue and figure out how to produce more of those culturally and linguistically competent physicians so that they can come back to disadvantaged communities. I'll just end, if I can, by trying to make it as real as I can. When I was looking during this pandemic of the century, I was looking around to figure out who would be able to do vaccine clinics in our unincorporated, small, rural, disadvantaged communities, and there wasn't anyone. And so I've been doing double duty for the last couple months as we've been holding more than a dozen clinics in small unincorporated areas like Biola, Cantua Creek, Lanier, Layton, Del Rey, small little towns, 1,000 or 2,000 people. But they wouldn't have access to healthcare if it weren't for providers going into those communities. So now more than ever, I am convinced of the need for us to make sure we are creating a diverse workforce that's more reflective of our community. I'm encouraged to see so many people on this panel who are working in that same direction. And hopefully we can use this pandemic of the century as an accelerant for change so that we can actually rise out of this pandemic stronger than we went into it. Thank you for having me on the panel.
Yes, thank you, Dr. Arambula, for those excellent words of wisdom. And we appreciate all your excellent work and considering you a tremendous partner in the work that we do with LPOC. Our final speaker, I'd like to welcome the Executive Vice President for UC Health, and this is key, the first and only Latina to serve in this type of role in the United States, Dr. Carrie Byington. Dr. Byington?
Thank you so much, Dr. Arevalo. It's such a pleasure and honor to be with this panel. I am relatively new to California. I am a Mexican American who grew up in South Texas at the border and really grew up with health disparities, watching health disparities in my own family. I didn't know that it was called health disparities then, but now I know what I was watching really propelled me to be a physician. I'm the first healthcare professional in my family, and really had no culture for medical school, no culture for health professions. And so I understand what the students are going through and what they need. It has been such a pleasure to come back to California. I'm really pleased to be working with LPOC and to be at the University of California, a public institution absolutely committed to increasing diversity and inclusion in our state. President Drake mentioned the PRIME program. This is a remarkable program. Now, over many years, the first PRIME program starting in 2004. As President Drake said, it has really grown and expanded representation in medical school across the state of California. The PRIME program took what were numbers in the early 2000s of maybe 14 to 15% underrepresented minorities in medical school, and maybe 10% Latinx students in medical school, to today 37% underrepresented minorities in our UC classes, and 20% of those Latinx students. That is a doubling in 20 years, which is really quite remarkable with the pace of how slowly things change in academic medicine. So that is a remarkable accomplishment. As President Drake said, it started as a small program, first focusing on Latino students. Today, there are 365 students in the Prime program throughout our 6 campuses. The Prime program has been instrumental in standing up Riverside as a medical school serving the Inland Empire, and it will be instrumental. The San Joaquin Valley Prime program will be instrumental in standing up the UC Merced Medical School. So this program is really diversifying and opening the profession for so many. Now that we are approaching 2 decades with this program, what else can we do? What additional innovations can we bring? So I'm very thrilled that there is proposed funding this year at the legislature to increase the Prime program. I hope everyone on this call will advocate with their legislators and the governor to get this passed, so that we can not only fund the program positions that we have 126 funded positions, yet 365 students in the Prime program. So we need to fund the existing positions, but also grow new ones. And so we're really excited about that. I am also very, very interested in the pipeline of medical education. I am a pediatrician. I believe that education begins very early and start early childhood literacy programs at 6-month well child checkups. But when you're talking about medical education, we need to look at the entire continuum from the undergraduate space through medical school and residency. And what can we do as a state to ensure that that workforce is supported from start to finish, and that they are incentivized to stay in California? One, that they can see a pathway that's open for them. 2, that we make it affordable, and that means shortening the training where we can shorten the training. I'm a big believer that in competency-based training rather than time-based training. We should let people learn at the pace and speed that they can and to perform. I finished medical school in 3.5 years. There are plenty of people who can finish in 3 years. There are people who can finish undergraduate in 3 years. Those extra years mean a lot when you're looking at 15, 17 years of training. So being able to shave off that time means a lot. I have talked with a number of legislators and our academic group. I would like to propose to the state a guaranteed match program for individuals who would be going into primary care, mental health. Other states have programs like this. California can do it. And this would reduce the cost of medical education and the interviewing that the medical students need to do in their 4th year, which they pay for completely on their own, and would incentivize the medical students to stay here in California. And if we were able to provide a guaranteed match, it would free up time in the 4th year for these students to see patients, to be placed in communities that lack access, and to be able to really jumpstart their residency program. I think that we need to work together, LPOC, the legislature, the academic enterprises of the community colleges, CSU, and UC, to craft a wraparound program that workforce that we need. Thank you very much.
Wonderful. Thank you very much. Now we'll be turning it over to Dr. Hernández, who will be working with our panel, and Dr. Hernández.
Thank you, and thank you to all the remarks that we heard. I remind folks if they have questions, they should put it in the Q&A and we'll try to get to a number of those. I really wanted to pick up on something that Dr. Diaz raised as she described her journey through her PhD and her medical degree. And that's that experience of being alone and sort of navigating these systems alone. And something tying back to something Dr. Drake mentioned as part of the goal of UC, which is really diversifying our faculty. Because I think one of the things we continue to have an enormous gap in is not seeing ourselves in faculty positions and in leadership positions within academia. And that, of course, makes that a lonelier experience and one that is harder to navigate. And so I don't know if Dr. Drake is still on. I know he had to jump off a little bit earlier, but if you are, Dr. Drake, I'd be curious how UC is thinking about this issue with diversifying the faculty.
I am still here for a few more minutes, Sandra. So great. And, you know, we think about this broadly. We think about it in medicine, but honestly, we think about it in law and philosophy and engineering as well. It's a problem across the board. So we have a thing called the President's Postdoctoral Fellowship Program. So now that I'm in this role, I could say that we have an actual program that really does fund and support people who are finishing their doctorate degree and thinking about what to do next, to actually try to bring them to the university. And I'd say a few things about that more than half of them are actually hired by the University of California, and about 85% of them make it on to tenure, which is a higher rate of tenure success than we have across the board. So this program is one that is successful in taking highly trained people focused on an academic career and providing a pathway to go forward. What we are seeking to do this year is to expand the program. And we have some, as I speak to our dear colleague, Assemblymember Arambula, when our budget, in fact, has money to expand this and other programs that are meant to support our diversity. It's wonderful, as I said, to hear the PRIME program mentioned all these years later. And I'll say that it's one of the things that was meant to be a hallmark of the program back then was it was created so that it would have roots and it would stick around and it would last. So it wasn't one-time money or a great thing to do when people cared, but then something that would go away when no one was watching. And there were times when the budget was squeezed. We went through the recession of 2008, 2009, and there was great pressure to reduce the funding of the program. I happened to be still at the university, so I was able to be on the inside there and try to hold back a bit, and the budget kept going, and now the program is growing. But I'll say when the program started, it was a fully funded program. That was part of the deal, is there was a funded pathway to move forward to make it so you could fulfill your dream. Over time, the campuses have done a great job to expand the program because of its great popularity, but the funding level has not followed, and so it's a bit of a stretch. And you know, when there's no funding behind a good idea, the idea becomes vulnerable, and we have to continue fighting forward for it. So we have things that we've started. We've all seen this through our lives. Those of us who are older have seen it more times, that we have 2-3 steps forward and then a step or 2 or 3 back, and then steps forward and steps back. What we're trying to do is to make the steps forward, make those institutionalized, and continue to push them as we go forward. And it really does take all of us working every day to push those things forward. But I have faith that by doing that, we can make more rapid and more important progress as we move forward.
Thank you for that, Dr. Drake. There's a member of our audience who asks, is there a way that volunteer clinical professors from other UC campuses couldn't help act as role models for our underrepresented minorities and Latinx folks as they are in their undergrad and medical pursuits? Is that something that's ever been tried or that might be possible?
Well, I'd say one of the things that, forgive me if I say this, all of us on the screen have our role models all the time, no matter what we want to be doing. It's our lot in life to do that. And I'm going to defer to others. I know certainly in my education that we had clinical faculty members as a significant part of the leaders and guide and the role models that we had. And I think that's a wonderful thing. It takes a village for sure. It takes a big village, and the more of us who can participate, the better. So I appreciate that very much. And Carrie, let me ask, give your comments on that as well. We would love to be as expansive as possible in bringing people on.
Yes, I believe there's real opportunities to tap the community. I have mentored Native American students in the past in Utah and really tapped into the Native community because you don't have necessarily the faculty that are representative, and that's been extremely successful. And we've been able to talk about as a system, how can we work across our system to actually cross-mentor and cross-train to use the resources that we have in individual locations and really spread them if we can. So I think there's a lot of opportunity there with both community participation and participation across our system to support different locations.
You know, a theme of this conversation has been about mentorship. And so I'd like to come back to Griselda. You mentioned a mentoring movement, and that sort of warmed my heart, the notion that we have a movement on mentorship. And so I wonder if you'll just say another word or two about MiMentor, how it works briefly, and the role that it plays in mentorship. Griselda, are you there?
Yes, Dr. Hernández. So to share a little, yes.
There you go.
To share a little bit more about MiMentor.
Yeah, what you were referring to when you were talking about the movement.
We do have our, sorry, there's a lag with the internet connection. So what I refer to the MiMentor movement is we have our free downloadable MiMentor app, our website, mimentor.org. And I invite all of you, to create an account and go on there to share opportunities for students. We have over now close to 12,000 mentors and mentees on our app. And many of our students have benefited from this year because we are virtual, from opportunities in the East Coast, because we are managing everything over Zoom. And our board, our MiMentor board, is continuously looking for mentors in our community to, inspire us and guide us as we are continuing our career in medicine in the health field.
Great, thank you. Dr. Arambula, I wanted to come back to you for a moment. As you know, there was a report done on the California Future Health Workforce that had an enormous focus on pipeline programs and on health equity and how we achieve it. It was a plan to 2030, and if anybody'd like to see that, that is on the California Healthcare Foundation's website. But I know, Dr. Arambula, there's quite a few efforts in the governor's budget and the legislature. You mentioned a couple of those. How do you think that this group can be most supportive of the legislative effort at continuing to invest in that workforce plan that was designed with leadership from the University of California and a lot of leaders across the state?
Great question. I wanted to make sure it was me. I thought I heard Dr. Arevalo earlier, but after you started talking about legislation, I got it.
No, Arambula.
First I will say, I didn't mention Prime or San Joaquin Valley Prime or UC Prime, but I'm a big fan and have been for a while. I think we need as many pathways as we can for students to be able to access. So whether or not that's HCOP or others. In terms of advocacy, because I also saw a question from a student in the question and answer, I would encourage you to reach out to my office at a minimum. We're quite involved in making sure that we're passing and working on advocacy regarding healthcare professionals. I'd also encourage you to look towards Dr. Wood, who I believe was also on that healthcare workforce that you were mentioning. Both of us share an interest in this area and are quite invested. Now, I would hope this year, as we have the windfall that we do as a state, that we actually take some of those resources and make sure we are doubling down on those pipelines, as you mentioned, Dr. Hernández. And so would hope and encourage all of us to advocate together. I will add my side. There is a lot more you can do when you're up here with broad brushstrokes than you can dealing with one person at a time. And so if we can together elevate and advocate, we are able to change the direction and help to change those systems. If we have structural racism, if we have systemic racism, at some point those systems can be changed by us too. And so I just would encourage us to be advocating together.
Thank you. Dr. Byington, you talked about potentially different paces by which we can get people through medical school, and that rather there be, sort of putting in your 4 years, there might be other tracks that people could pursue. And yet today in California, we know that many of our undergrads can't get all the courses they need to finish in a 4-year program. And that's true at CSU as well, I think. And so it does seem to me that we have a lot of work to do to get to the vision that you articulated. And so I wonder if, as you think about at least the UC system and really how we get people the programs that they need and the coursework that they need to be able to finish in a timely way, so that this is not a really long and unnecessarily beyond what it is legitimately protracted course. And so I'm just curious if you have a vision of where we are now and how we might get to what you described, which would be really revolutionary in terms of cost, and also just accelerating how quickly we can get underrepresented minorities into our delivery system in the state.
Right. I think first of all, you have to have a vision for where you'd like to be, and be able to share that vision with students, because they have to be able to see their future. At UC, there are a number of programs already focusing on 3-year degree programs, and one in particular at UC Santa Cruz. And I'm going to begin to work with the provost there to see how can we ensure that students who want a health professional degree, that they can also participate in this 3-year program. Working across the state with community colleges and with CSU, we need to be ensuring that students can transfer credits and that credits can move from institution to institution, so that they are not losing dollars on courses that don't transfer. So we have to remove those structural barriers that keep people from engaging or completing their degree in a timely way. There was a question in the chat about the JAMP program in Texas, one that I'm very familiar with, which is a program that for 3rd and 4th year undergraduate students interested in going to medical school, and provides a great deal of mentoring, extra training, help with MCAT, preparation for medical school. And if you complete that program, you are guaranteed a match. If you complete the program and you have the grades, you're guaranteed a match within the Texas medical school system. Why couldn't we have something like that, a similar program like that in California, to move from undergrad to professional school, but also a similar program to move us into residency? We know if students complete their residency in a state, that is where they're going to stay and practice. And we have to be able to open up opportunities, especially in areas that are underserved in the state. I'm very interested in UC Health expanding our footprint into the more underserved areas where we can train our students and offer healthcare to the populations there as well. So it is a big vision, and there's lots of stakeholders here, but we have one public system in our state, and it seems like we could rally and make the efforts to ensure that we're making progress through our public system as easy as possible, so that more people can complete.
When we were doing the Workforce Commission work, we heard testimony and saw data that a lot of our Latinx and underrepresented folks that do get through our medical schools then don't have the places to match.
Right.
To do their residency in the state, and we lose those folks to all kinds of places across the country. And as you rightly note, typically where people do their residency, as Dr. Arambula mentioned, is where people go and stay and serve. I'm a very good example of that. I'm an alum of the UCSF primary care program, and here I am in San Francisco. So that definitely happens. And I guess GME is a constrained resource. Is there any partnerships that UC could imagine to expand GME capabilities in the state so we don't lose our talent once we've got them through medical school to residencies outside?
We have an opportunity at the federal level, and we are really advocating for that. For the first time in one of the CARES relief packages, the first time since 1992, there is a plan to expand GME. And there are at least 1,000 slots that have been proposed. Of course, we need many more slots than that across the nation, but we need to be advocating for bringing as many of those spots as possible to California, the most populous state in the nation. And the requirements are that these be residency programs that are in underserved areas. So we really need to be working to develop those residency spots. Of course, Proposition 56 has helped us support residency expansion in California as well. And being able to invest in GME and offering people guaranteed matches within the state, especially in high need areas, would allow us to keep more of our graduates here.
Well, I am conscious of the time, and I will just say, going back to something that Dr. Cruz said in his opening remarks, which is we have an extraordinary moment, I think, coming off of this pandemic with the Secretary of Health and Human Services, Javier Griselda, giving leadership there. Our opportunity to work with the federal government arguably could not be better. We have a legislature and a governor who understands these issues. We have extraordinary leadership within our public institutions. And we have the talent and resilience within our young people that really want these pipelines to work. And so I think this conversation has been exciting, enlightening, and compelling that all of us need to step up in all of these forms to make sure that we can leapfrog and really accelerate the representation of our Latinx folks within the communities throughout California, where there is such need and such mismatch today. So with that, I'll give it back to you, Dr. Arevalo. And again, thank you all to the panelists. A real honor to be with all of you today. And thank you for spending time with us.
Thank you.
Thank you, Dr. Hernández. Before Dr. Arevalo closes, I just wanted to say, Bobby Pena, CEO with LPOC, thank you all for joining us. There was a few questions in the Q&A that we did not get to. So please, we will try to address some of those on our website and through our newsletter. And there was, I know, a number of questions about how we can advocate for some legislation that was discussed. LPOC will work closely with Dr. Arambula and others and help, especially our students, help you get connected and find opportunities for you to advocate on behalf of some of these issues. So I will turn it over to Dr. Arevalo to close.
Thank you, Bobby. I want to thank you all for joining us this evening for this important dialogue. If you are interested in joining in on our ongoing efforts on these issues, please reach out to us via our website. If you're not already, we encourage you all to become members of LPOC as physician members, student members, as affiliate members, or as a nonprofit or corporate level. Again, I want to thank Adventist Health and Radio Bilingüe for their support on this effort. Your support is truly appreciated, and we look forward to our continued partnership. I also want to once again thank all our presenters for their great words, their wisdom, and their efforts to work with us to grow a more diverse healthcare workforce for California. A recording of this forum will be available on our LPO website, so please encourage others to watch who may not have been able to join us tonight. Thank you again for joining us. Stay safe y buenas noches.
Gracias.
Thank you all.